Okay, last week we heard from Michelle Smith as she interviewed me on my own personal journey in the launch of Birth Story Media, the book and the online course, and this podcast. She is also my favorite hypnobirthing instructor. And in fact, her episode on my podcast, number 30, What is Hypnobirthing?, is the number 3 most listened to episode of all time on my podcast. And so this week, I thought I would bring you another one of Michelle Smith's episodes all about hypnobirthing, part 2. Okay, let's get to it.
Hello, Birthies families. Welcome to this heartfelt space. I'm your host, Michelle Smith, and I truly am so grateful that you are here. In this episode in my series on hypnobirthing and birth hypnosis, I wanted to share a bit about what brought me to hypnosis, and specifically birth hypnosis. And in this episode, because I was fortunate enough to train and certify as both a Hypnobirthing the Mongan Method practitioner and as a Hypnobabies Network instructor, I will also be diving a bit into the hypnobirthing versus hypnobabies debate. My journey with hypnosis-assisted childbirth began over 18 years ago. Shortly into my career as a doula, I attended several births in a row in which the mother, her partner, or a relative expressed during the birth that they were now facing what they considered to be their greatest fear realized. And while some obstetrical emergencies are unavoidable, I did and do understand how fear and unaddressed trauma can follow us into our births and inhibit or shut down a labor. This sparked within me the desire to seek out ways to help parents release their fears in order to work with instead of against the process of birth. While I could help families understand their options in maternity care, I also wanted to provide them with powerful tools to achieve the natural birth they so often desired and which I believe our female bodies are intrinsically designed to do. While I was already familiar with the power of hypnosis, I began researching different birth hypnosis methods. I found Winifred Cockling's book, Hypnosis for a Joyful Pregnancy and Pain-Free Labor and Delivery. In late 2002, this book led me to a hypnobirthing practitioner training in South Florida. During the training, I knew deep within my soul that this is what I was meant to do. Craving more, I further trained and certified in clinical hypnosis. In 2004, one of my hypnobirthing clients introduced me to the Hypnobabies Painless Childbirth Hypnosis Program. As a Christian, she was feeling uncomfortable with some of the inclusive languaging in the hypnobirthing program that would refer to her as a child of the universe versus a child of God. She also craved a bit more structure in the program, and she found and introduced me to the Hypnobabies Painless Childbirth Hypnosis Method. I still vividly remember chatting on the phone with Carrie Tushoff, the founder of the Hypnobabies Network, as we discussed what prompted her to create the Hypnobabies Childbirth Hypnosis Program. We both agreed that hypnobirthing the Mongan method was limited in the use of only one recording that was supplied to students. For some birthing people, this was enough, and yet many others would benefit from a more thorough birth hypnosis practice. Due to Carrie's generosity and kindness, I was truly blessed to certify as the 12th Hypnobabies instructor. I became one of the first to teach hypnobirthing the Mongan method and bring hypnobabies to the Orlando and Kissimmee St. Cloud, Florida area. I taught hypnobabies for about 4 to 5 years. Initially, as instructors, we were able to certify in both of the birth hypnosis methods, and I would teach which method I felt would benefit my client most. Within a few years, however, there was a push from the Hypnobirthing Institute stating that we could only be a certified hypnobirthing practitioner if we exclusively taught their method. Due to lawsuits regarding copyright and hypnobirthing the Mongan method, we could not be affiliated with Hypnobabies Network, In fact, we were not allowed to even teach a birth hypnosis method of our own and teach hypnobirthing the Mongan method at the same time. I was even told that I could no longer teach my birth ease method that I created in 2004. I explained to them that I created this method for families uncomfortable with the idea of hypnosis, and it was guided relaxation based. Fortunately, they relented on that. The Hypnobabies Network began requiring the same recertification parameters as well. And so it was a difficult decision to have to choose one method over the other. And after much soul searching, I continued to recertify with the Hypnobirthing Institute, in part because it offered me a bit more flexibility. I appreciated its simplicity, and I resonate more with a facilitator type versus authoritative type teaching style. As a birth hypnosis specialist, I have studied multiple birth and fertility hypnosis programs, including Dr. Richard Widmeyer's New Concepts in Painless Childbirth, the LeClaire Method for Fertility and Childbirth, the Fertile Body Method, the Mind-Body Fertility Connection, Hypnofertility, and the Childbirth Creative Visualization Techniques of Carl Jones. I certified as a hypnobirthing fertility consultant in 2010 and as a hypnomothering practitioner in 2015. My love of hypnosis and the results it can and does achieve have driven me to continue to train in and certify in clinical hypnosis, including parts therapy. I certified in regression therapy in 2006, in practical Ericksonian hypnosis in 2011, and in neuro-linguistic programming, NLP, in 2017. While I am well-versed in hypnosis, my specialty includes, but is not limited to, fertility, stress reduction, childbirth, grief and loss, and also helping parents resolve any trauma or post-traumatic stress that may have occurred due to their pregnancy or birthing. I have found that resolving birth trauma is especially valuable when moms are planning a vaginal birth after cesarean or are pregnant again after a loss due to miscarriage, stillbirth, or abortion. I have gone on to train extensively in trauma and grief, and I'm proud to have certified as a grief counseling specialist. So now that I've shared a bit of my history with birth hypnosis, I thought it would be fun to share this Orlando Sentinel article that I was featured in about hypnobirthing. It was written in 2003 by Dorimar Mercado, who was expecting her first child. I was honored when she decided to take hypnobirthing classes with me and have me attend her birth with her as her hypnodoula. She had an unmedicated natural birth despite her doctor's disbelief regarding her ability to do it. This is the article. Mention the words labor and delivery to many women, and thoughts of excruciating pain and prolonged agony are sure to surface. More and more women everywhere are searching for alternative ways to relieve labor pain. Techniques such as Bradley Method and Lamaze, two forms of natural childbirth, are popular with expectant moms, but many say that once the pain of contraction starts, the techniques go out the window. One technique that is gaining popularity with women and members of the medical community is hypnobirthing. Hypnobirthing combines hypnosis with comprehensive childbirth education, deep relaxation, imagery, exercises, and positive affirmations to relieve the pain associated with labor and delivery. Michelle Smith of St. Cloud, a certified hypnobirthing practitioner and doula, or birth assistant, acknowledges that there are similarities between the different methods of natural childbirth, but says that the use of hypnosis makes hypnobirthing a more effective pain-reducing technique. It's like getting a very powerful extra tool to release fear and to create deeper, more profound relaxation, Smith said. The hypnobirthing program was developed in 1989 by clinical hypnotherapist Marie Mongan, and it is based on the work of an English obstetrician, Dr. Grantley Dick Reed. considered by many to be the father of modern natural childbirth. Dick Reed believes that pain in childbirth was brought upon by what he called the fear, tension, pain syndrome. When a woman is afraid, she gets tense, which brings resistance and pain. The pain I felt while giving birth to my first child was so overwhelming that I felt out of control, said Lynette DeLeon of Orlando, who is expecting her second child this fall. I wanted to have a natural birthing experience, but after 24 hours in active labor, I felt exhausted and unable to go on. It was then that my doctor suggested an epidural. Risks of anesthesia. The epidural, or anesthesia administered through a catheter inserted near the base of the spine, is, according to many in the medical community, the most effective form of labor pain relief. That relief, however, does not come free of risk. Some of the complications associated with epidural anesthesia are an increase in uterine infections, longer labors, and more interventions such as cesarean sections and the use of forceps to deliver the baby. Many mothers are also concerned with the effects the drugs may have on their unborn babies. Proponents of hypnobirthing say the female anatomy is perfectly designed to experience relatively pain-free childbirth when a woman is able to relax and work in harmony with her body. Smith teaches her clients to empower themselves and trust their bodies. You have to let go and let your body do what it knows it needs to do. She has noticed that women using the technique during labor respond as though they were given an epidural. Karen Schulte of Winter Garden used the hypnobirthing method for the birth of her first child. Thanks to the techniques, I was able to relax and be very calm, Schulte said. One of the nurses even said, "I've never seen this except on television." Schulte said that the contractions felt like pressure, not pain. Techniques benefits. The use of hypnosis to relieve labor pain is nothing new. It was effectively used as far back as the early 1800s. It has been used for years by the members of the American Society of Clinical Hypnosis, an organization that promotes excellence in the use of hypnosis by qualified healthcare professionals. Dr. Paul Schabel, a psychologist, member of the ASCH, and professor of psychology at the University of Florida, has been using hypnosis to treat patients since the 1960s and has seen firsthand the effects it has on laboring women. Schabel supervised a study published in the May 2001 edition of the Journal of Family Practice titled The Effects of Hypnosis on the Labor Processes and Birth Outcomes of Pregnant Adolescents. In the study, 42 patients were randomly divided between a treatment group that received childbirth preparation using hypnosis techniques and a control group that received non-hypnosis supportive counseling. The study found that the women in the hypnosis group had fewer complications and surgical interventions and less need for anesthesia. They also had shorter hospital stays and quicker recoveries. The researchers concluded that the medical benefits to mother and child also suggest the potential for a corresponding cost-saving benefit for hospitals and insurance companies. We were surprised by the extent of the results, Schabel said. Schabel thinks that the reason hypnosis isn't more widely used is because more clinical studies need to be conducted in order to convince the members of the medical community of its effectiveness. He said, obstetricians he has worked with, however, have noticed the benefits of the technique and end up referring patients to him. Hypnosis Misconceptions. He also notes popular misconceptions about hypnosis that may play a big part in the resistance to the method. Before learning about hypnobirthing, I thought that getting hypnotized meant going into a zombie-like trance and being rendered helpless to the control of another person, Leon said. Retta Peoples of Orlando, who is pregnant with her first child, said she had the same misconceptions about hypnosis, but is now glad she's willing to give it a chance. I was very afraid of giving birth so much that I was having panic attacks just thinking about it, people said. I'm no longer afraid of the pain, which is amazing. I never thought I would say that. Orlando Sentinel, 2003. So what is hypnosis? Hypnosis is a natural state we all enter in and out of every day. Hypnosis is simply a state of profound relaxation and focused concentration. Hypnosis elicits the relaxation response within the body, a state of deep rest that occurs when a person is profoundly relaxed. It counteracts the body's physical and emotional response to stress, allowing it to return to a calm, relaxed state. This causes a measurable decrease in heart rate, blood pressure, breathing rate, muscle tension, and stress hormone levels. This is especially important for conception, pregnancy, and birthing. The relaxation response also causes normal waking brainwave patterns to shift to predominantly lower patterns and pave the way for hormonal and immune systems to return to normal. Hypnosis also enhances the mind-body connection. This allows the body to do such things as speed healing, increase a mother's milk supply, decrease stress, and even alter the perception of pain. In 2006, a researcher named Hauser did a meta-analysis and looked at all the randomized trials on using hypnosis for a variety of purposes. They found that hypnosis was superior to usual care in terms of reducing emotional stress, making you have a quicker recovery, and decreasing your need for pain medication. They concluded that hypnotherapy is a safe and effective complementary medicine technique for use in medical procedures, and that it even shows promise for helping people manage irritable bowel syndrome. According to a study featured in American Health magazine comparing psychoanalysis, behavioral therapy, and hypnotherapy, psychoanalysis had a 38% recovery after 300 sessions. Behavioral therapy showed 72% recovery after 22 sessions, and hypnotherapy showed a 93% recovery in only 6 sessions. So can I be hypnotized? Anyone who can listen to directions can be hypnotized. All that is necessary is the imagination and a willingness to cooperate. The ability to be hypnotized is dependent upon the ability to relax and merely listen. Occasionally, a person may need several attempts before actually entering into hypnosis. Generally, this is due to the person holding on to a little bit of fear of loss of control, or a part of themselves resisting the positive changes they desire to make. The clients that realize the best results have a good reason for seeking out hypnosis and a strong motivation to accomplish their goal or desire. This certainly is the case for mothers planning a natural birth. So other common questions are, will I do something against my will, or can I get stuck in hypnosis? I want to reassure you that all hypnosis is self-hypnosis. You choose to enter, stay, and exit this natural, relaxed state at all times. Therefore, no one can ever be hypnotized against their will. The hypnotist or hypnotherapist is simply the guide that assists you to tap into the incredible power of the mind-body connection. A suggestion can never be given that would cause you to do anything against your ethics or moral values. Hypnobirthing assists families in releasing negative programming about birth and creates a relaxation habit within the body. The suggestions given are to help you return to your natural birthing instincts. The proper use of hypnosis actually gives you greater control over all aspects of your life. Remember, hypnosis is a natural state that everyone enters into every day. Therefore, it is impossible to get stuck in hypnosis. There is no danger of a person failing to come out of the hypnotic state. You are neither asleep nor unconscious, just profoundly relaxed. So why birth hypnosis? Sadly, these days, women are often ridiculed or shamed if she shares that she would like to give birth naturally without pain medication. Friends, family, co-workers, strangers, even medical caregivers are quick to dismiss her, claiming, "Well, you can try to give birth without an epidural, but I don't believe you'll be able to do it." When remarks like these come from an authority figure, it is known as what we refer to in hypnosis as a prestige suggestion. Negative prestige suggestions like these can completely undermine a woman's belief in herself. When a woman's subconscious is programmed with negative beliefs about pregnancy and childbirth, it causes her to doubt herself, her body, and her ability to give birth and mother her child. If it is her first pregnancy, her subconscious mind does not have any previous personal experience to refer to. Therefore, it references everything she has been told by others, watched on television or in movies, and viewed on the internet. If her subconscious is programmed with scary and disempowering thoughts, beliefs, and images, she can and may go into fight, flight, or freeze mode in order to protect herself and her baby. This can make for a more stressful pregnancy and a painful, frightening birth experience for them both. The beauty of hypnosis-assisted childbirth is its ability to de-hypnotize these negative messages and beliefs that are constantly coming at pregnant people in all different directions, from the media, caregivers, friends, family, and even strangers. Fearful thoughts and/or negative emotions can inhibit the hormonal balance necessary for laboring efficiently. The hormone oxytocin, which is released by the anterior pituitary gland, regulates uterine contractions. Oxytocin is less likely to be released if a mother is upset. At the same time, the stress hormones released when she is very tense can impair labor. This fear and tension cause the muscles around the cervix to tighten. Longer and harder contractions become necessary to open the tight cervix. Tension also decreases the available oxygen to the uterus when a mother enters into flight, fight, or freeze mode, which can lead to more painful contractions as well. A confident, relaxed state eliminates the fear, tension, pain cycle, thus maintaining the necessary birthing hormones and enhancing the release of endorphins. Endorphins are our own natural pain relievers, which are 200 times stronger than morphine. With hypnobirthing, you learn how to tap into nature's own epidural and call upon your body's own natural relaxant, thus lessening or even eliminating discomfort and the need for medication. Using birth hypnosis techniques during pregnancy and birth positively impacts your baby and you. Purposely taking time each day to relax lessens tension and fears and reduces the amount of stress hormones present within your body and your baby's body. Research has shown that the hormones produced by a mother experiencing chronic stress will alter the distribution of the blood flow in her baby and change the character of her developing child psychology. Birth hypnosis elicits the relaxation response, which counteracts the body's physical and emotional response to stress, allowing it to return to a calm, relaxed state. When a person elicits the relaxation response, there is a measurable decrease in heart rate, blood pressure, breathing rate, muscle tension, and the stress hormone levels. The relaxation response also causes normal waking brainwave patterns to shift to predominantly lower patterns and pave the way for the hormonal and immune systems to return to normal, benefiting mother and child both. A study concluded that babies who experienced the calm of hypnobirthing in the womb during their birth were more likely to be described as calm, content, and happy as both babies and older children. The hypnobirth babies were also more likely to be reported as good sleepers, as well as easy and alert babies. Mothers fondly remark on the deep connection and bonding present with their babies that took place during their pregnancies. These benefits extend beyond birthing and provide valuable life-enhancing skills that can be used for the rest of their lives. And so, as mentioned in the Orlando Sentinel article, hypnosis has been effectively used as far back as the early 1800s. It saw a resurgence in the 1950s. And in fact, a friend of mine was an OB nurse and worked for an obstetrician who very successfully used hypnosis with his patients in the 1950s. I own a copy of Childbirth with Hypnosis by William S. Kroger, MD, from the 1960s. And it's really a fascinating book. I'm just going to say there's parts of it that reflect the time period in which it was written, that male medical perspective on birthing women from the 1960s. And that's a whole nother discussion. However, hypnobirthing, the Mongan method, was first established in 1989 when Marie Mongan's own daughter was expecting her first child. Marie Mongan began holding classes in hypnobirthing, and around the same time, Michelle LeClaire also created a hypnobirthing program. It's my understanding that there was a court battle between the two regarding who had the legal rights to use the term hypnobirthing. Marie Mongan passed away in June 2019, and I feel incredibly grateful to have met her and learned from her. She truly was a pioneer in both the world of hypnosis and natural birth, and she has left us a powerful legacy. Carrie Tushkoff, the founder of Hypnobabies, began her career in birth as a doula and childbirth educator in 1989. She was a Bradley Method instructor for 15 years, and then she became a hypnobirthing instructor. As I mentioned earlier, she felt that there were elements missing from the hypnobirthing course. As a result, she created her Hypnobabies Painless Childbirth Program, which includes medical hypnoanesthesia techniques designed specifically for childbirth. Mickey Mongan felt that Carrie appropriated the foundations of her hypnobirthing course, and a lengthy legal battle ensued. I feel that this is a part of why the Hypnobirthing Institute and the Hypnobabies Network became so strict about instructors being affiliated with only one program. Marie Mongan and the Hypnobirthing Institute have also had court battles to protect the copyright of her course and the registration and trademark of hypnobirthing, which has become with time a generic term, especially in other countries outside the United States. I've recently seen ads on Facebook for a hypnobirthing diploma class. As hypnosis for childbirth has gained popularity and acceptance, many other programs have popped up, which is wonderful for families in the birth world. However, I fully understand and respect that the founders of these 3 birth hypnosis programs want to protect the integrity of their life's work. It's kind of like someone running off with your baby. And so now I thought I would share a bit about each of these 3 birth hypnosis methods from their websites. The hypnosis of the LeClaire method. The center of the LeClaire method is to keep the mind out of the body's way so that the body can do its work, and this requires psychological, spiritual, and emotional preparation. Once some of that work has been done, you can let go and allow yourself to be hypnotized, making your labor easy and nearly pain-free. Hypnosis for labor and birth is a state of deep concentration of your mind and deep relaxation of your body, which permits the easy passage of your baby through your gradually widening birth canal. Your mind and body can do amazing things, and when we take time to observe and remain mindful of what they can do, we can harness that power to give the baby a magic carpet ride from the womb to mother's arms. For these reasons, I hope you'll take the time to learn these techniques of hypnosis for pregnancy and labor. The word hypnosis derives from the name of the Greek god of sleep, Hypno. It conveys the idea of the ease and rest of sleep, of letting go and allowing the body to do its natural work. Hypnosis also enhances the progress of your labor and allows you to positively anticipate and calmly assist in the birth of your baby. With hypnosis, you can easily get through labor without chemical anesthesia. The choice is always yours, of course. You may ask for and receive drugs if you like. Be aware, though, that new evidence indicates that children of mothers who receive opiate derivatives during labor have a higher incidence of drug abuse later in life. In contrast, mothers who experience severe pain and feel out of control can later in life experience an increase in suicidal ideation. In contrast, hypnosis gives you full control. The LeClaire method of preparation is the best anesthetic for optimal short-term and long-term benefits of pain relief and continued emotional serenity for both mother and baby. The hypnosis of the LeClaire method offers demedicalization of labor and birth by creating a natural physical anesthesia in the mother. This allows her natural and instinctive ability to birth her baby to become manifest. Hypnosis also allows the mother to move about freely in a comfortable, natural manner. She is able to change her positions as needed, which in turn increases her comfort and facilitates the progress of her baby's birth. It's important for you to begin preparing for birth by playing your hypnosis and pregnancy tape throughout your pregnancy. Practice will increase your confidence in your ability to imagine desired outcomes and to relax deeply. By preparing early in pregnancy, you will foster your expectancy for a comfortable, easy pregnancy, labor, and birth. The LeClaire method is your baby's inherent way to come into your world and is your inherent right to believe that you can have a healthy, comfortable birth. You do not have to learn how to birth comfortably. You only have to be allowed to do what is the nature of your body. That is, to progress through labor unrestricted by chemical anesthesia, unrestrained by confinement to the bed, unrestrained by continuous electric fetal monitoring, unrestrained by the beliefs of the medical culture. All you need to do is to remember, silently, to reconnect to your nature. It is your body's nature to know how to respond to your contractions, and is the nature of your body to know when to push. If chemical anesthesia or the direction of others, except in a medical emergency, takes away your sensations, you are not honoring yourself. We have the right to vote. We have the right to work. We must now have the right to squat and move about freely during labor and to follow our body's instinctive wisdom to know when to push. Hypnosis is your baby's easy way out. So that was the LeClaire method. And now about the official Hypnobirthing Institute, the original and still the best. Hypnobirthing, the Mongan method, is as much a philosophy as it is a technique. The concept of hypnobirthing is not new, but rather a rebirth of the philosophy of birthing as it existed thousands of years ago, and as it was recaptured in the work of Dr. Grantley Dick Reed, an English obstetrician who, in the 1920s, was one of the first to forward the concept of natural birthing. This method teaches you that, in absence of fear and tension, or special medical circumstances, severe pain does not have to be an accompaniment of labor. You will gain an understanding of how the birthing muscles work in perfect harmony as they were designed to do when your body is sufficiently relaxed and you trust birth. You will learn how to achieve this kind of relaxation, free of the resistance that fear creates, and you will learn to use your natural birthing instincts for a calm, serene, and comfortable birth. When you have your baby with hypnobirthing, you will not be in a trance or asleep. What you will experience is similar to the daydreaming or focusing that occurs when you are engrossed in a book or a movie or staring into a fire. You will be conversant and in good spirits, totally relaxed but fully in control. Awake throughout, you will be aware of your body's surges and your baby's progress. But because you will have trained yourself to reach complete relaxation, you will be able to determine the degree and the manner in which you feel the surges. You will experience birthing in an atmosphere of calm relaxation, free of the fear that prevents the muscles of your body from functioning as nature intended them to. In this calm state, your body's natural relaxant, endorphins, replaces the stress hormones that constrict and cause pain. Trained hypnobirthing educators are successfully teaching women and their birthing companions to trust birth and release all fear and limiting thoughts. Hypnobirthing educators can be found in 46 countries throughout the world. When you change the way you view birth, the way you give birth will change. Marie F. Mongan. So that was hypnobirthing, the Mongan method. And lastly, hypnobabies. Hypnobabies. Yes, these are babies whose parents choose to easily and naturally prepare for childbirth using the hypnobabies method of hypnotic childbirth, which some might call hypnobirthing. Hypnobabies, however, is very different in that at Hypnobabies we teach real medical-grade somnambulistic hypnosis rather than using simple relaxation, breathing, or guided imagery. This allows our Hypnobaby students to enjoy eyes-open childbirth hypnosis, easily remaining deep in hypnosis while walking, talking, and changing positions, being as mobile as they would like to be during their childbirth. Hypnobabies is well known for helping people create much shorter, easier, and more comfortable labors, making childbirth the joyful experience it was meant to be. Expectant students use our Hypnobabies workbook, audio tracks, and hypnosis scripts to retrain their subconscious mind that contractions in labor will be perceived by their body as pressure or as squeezing type sensations, and or pushing, pulling, and normal baby movement sensations. With the use of real medical-grade hypnosis and the type of hypnotic compounding, repetition, that our Hypnobaby students learn, practice, and use during labor, normal birthing sensations can easily be transformed into pleasurable ones. Our students are also fully in tune with their babies during the birthing process, and is aware of everything around them as they'd like to be, easily able to communicate with their support team, and completely in charge of their own birth experience. Hypnobabies uses the same medical hypnosis techniques that people employ when preparing for surgery without any drugs, which is called hypnoanesthesia. Our classes also teach Hypnobabies' birth partners how to fully support their pregnant partners, and Hypnobabies is also used very successfully by single mothers. A willing birth partner is a bonus. Including a very comprehensive childbirth education curriculum also ensures that our students remain deeply committed to their Hypnobabies training, since they will need to not go anywhere else for childbirth education. Other natural childbirth classes are wonderful, but many teach pain coping and pain management, which is directly in opposition of our Hypnobabies suggestions that encourage an easier, more comfortable, joyful childbirth. Hypnobabies includes 21 hours of classroom instruction, 6 classes, instead of 8 or 10 hours. And although other childbirth programs may contain some excellent hypno tools for birthing, none contain the amount of information, in-depth hypnoanesthesia, training, practice, and support of Hypnobabies. All elements have been carefully designed to work together, and the results are excellent. So that's Hypnobabies. And I do want to mention that hypnobirthing classes are taught in a format of 5 2.5-hour classes. If you are very near your birthing time, occasionally your practitioner can make special arrangements for individual classes with you. Now that you have an idea of what each method is about, in their own words, As someone that was able to certify in and teach both hypnobirthing, the Mongan method, and hypnobabies, I just want to share a few of my thoughts regarding each for families that are looking to decide which method is best for them. Honestly, I do not feel one is superior to the other. Each has its own strengths and weaknesses. Both of the founders genuinely care deeply about making a difference for birthing families. I am no longer affiliated with the Hypnobirthing Institute nor the Hypnobabies Network, and I have not recertified in either method for a number of years now. I believe that this allows me a more neutral opinion of each, and I want to give the caveat that there may have been changes made to both programs since that time that I was teaching each method. So here we go. Both the Hypnobirthing and the Hypnobabies programs provide instructors training in birth and hypnosis if they do not have experience in each. Hypnobabies requires their instructors to have 50 hours of instruction in hypnosis before they can certify, which I agree is foundational, especially when working with medical hypnosis techniques. Both programs do incorporate fear-release hypnosis sessions within their programs. Personally, I'm particularly fond of Mickey Mongan's Hypnobirthing one. It is powerful, and I have seen some clients achieve some incredible results from it over the years. I've just seen some amazing transformation. Both the Hypnobirthing Institute and the Hypnobabies Network offer hypnodoula certification courses for birth professionals that would like to understand the important nuances and distinctions that are a part of supporting families using birth hypnosis. Honestly, I feel a part of what makes either program successful is the skill and experience of the practitioner or the instructor. Ideally, it's best when possible to find someone with expertise in both birth and hypnosis and is maintaining a practice in both. Hypnobirthing is based in hypnosis and utilizes several hypnotic techniques such as the glove of anesthesia, arm drop techniques to reinforce the depth of relaxation, and deepening techniques. However, the foundational hypnobirthing audio recording Rainbow Relaxation is more guided imagery based. There are additional recordings that come with the hypnobirthing book itself and a couple of scripts that can be read by the birth partner to the birthing person. The ones in the book are not as user-friendly in my opinion. For families concerned about hypnosis, hypnobirthing is a gentler transition into the world of birth hypnosis. Hypnobabies uses true medical hypnoanesthesia techniques adapted from Gerald Kine's Painless Childbirth program, which also utilizes an eyes open hypnosis technique, and I feel this eyes open technique can be invaluable. Hypnobabies is very thorough, and students receive multiple recordings to practice with. There are very specific and clearly written out scripts for birth partners to read aloud to the pregnant person to reinforce the techniques. And these additional recordings and specific scripts are a part of what I felt was missing with hypnobirthing. Both hypnobirthing and hypnobabies require a commitment to practicing the techniques, just like the LeClaire method mentioned as well, to get the best results. Hypnobabies requires a much bigger time commitment for both the birthing person and their partner. The scripts that partners are to read are approximately 30 minutes long. This may be extremely difficult when someone has small children or a busy lifestyle. The amount of homework could easily be very overwhelming for some. I can see how someone could look at the work required and close the workbook thinking, oh my gosh, this is just not doable for me, it's too much. Both programs provide a complete childbirth education, and both programs strive to involve the birth partner. I feel that Carrie's experience as a former Bradley instructor is reflected in the detail of the Hypnobabies course and on the focus on the role of the birth partner. This is wonderful if you have a partner that is desiring and able to be fully involved in that way. It can really deepen your bond. However, if your partner does not feel capable of that deep level of practice and involvement, and honestly, some partners genuinely are not, and that deserves to be honored. We all have our own comfort level. So this focus on the birth partner could set a pregnant mom up for feeling let down by her partner during the pregnancy and birth if a partner isn't able to commit to that level of participation. I think that hypnobirthing is a better option for someone that wants a simpler approach, less practice time, believes the techniques will work for them, and perhaps has been using meditation, hypnosis, or self-hypnosis as a part of their lifestyle. Hypnobabies is a great choice for someone that likes a structured, detailed, information-dense approach, enjoys having homework and checking off all the boxes, and has plenty of time for practice. It can be preferable for people that are not sure if birth hypnosis will work for them, or if they have very little experience with meditation or hypnosis. One of Hypnobaby's strengths is the compounding that takes place with the multiple audio recordings and techniques that build on each other. Please note, however, Hypnobabies is not a good choice for you if you do not like an authoritative approach to homework and learning. If you're looking for a home study course, Hypnobabies is by far the better choice. While you can learn the hypnobirthing techniques with the book and CD provided, my understanding is that Marie Mongan did not intend for the book to be a replacement for the classes. She felt strongly about the benefits of working with an instructor. And I agree, yet at the same time, that's not always possible. One gift of the COVID pandemic has been the necessity for virtual learning. It makes these childbirth programs and others more accessible for families. And so for myself, as I maintain my practice in the field of hypnosis and regression therapy for over 18 years, I found myself frustrated and restricted in my ability to fully meet the needs of my birthing clients or to create recordings in my own voice for them. Since I'm blessed because clients consistently comment upon how relaxing and soothing they find the sound of my voice. And this resonance with my voice is incredibly valuable when I'm honored and privileged to attend a birth as a hypnodoula. Therefore, with time, as I mentioned, I thoughtfully chose to no longer recertify or be affiliated with neither the Hypnobabies Network nor the Hypnobirthing Institute. Again, both programs are excellent, and I sincerely admire the founder of each method, and I'm very, very grateful for all they've done for the birth community and to advance the field of hypnosis. For myself personally, I chose not to be forced into an alliance with either brand to the exclusion of all others, or to teach a particular hypnobirthing philosophy or childbirth hypnosis program. As a birth hypnosis specialist, an inclusive independent educator, I cater my instruction and skills to reflect each family I work with. Each class session is individualized to meet their unique journey through pregnancy, birth, and to parenthood. My hypnosis-assisted childbirth classes provide a birthing person deep, powerful relaxation techniques that are taught in an incremental approach. Each session of the class series builds on the next, facilitating the release of fears. My individualized classes help you connect with your own inner wisdom and define your own beliefs about pregnancy, birth, and parenthood. Women naturally go inward during labor, and hypnosis-assisted childbirth skills help you to more effectively maintain nature's own labor land. This relaxation habit is a tool you can use on your own whenever you may need it. I feel this is vitally important, especially during labor. If I make a woman dependent on me, a partner, a doula, or another birthing support person to help her maintain this relaxation, I don't feel I'm serving her well. Of course, a birth companion reinforcing the skills is extremely valuable. However, that's not something that every birthing woman has or every birth partner is able to provide. And so, as I have worked individually with hundreds of families over the years, I've taught some form of birth hypnosis well over 600 times. I have found that everyone's life experiences, needs, and situations are unique in their journey to parenthood, yet all parents and their babies benefit from stress reduction techniques and relaxation skills, providing families with the skills that will last them far beyond the birth of their baby is my passion. While birth hypnosis can definitely help mothers to achieve a natural, unmedicated birth if desired, the education, relaxation skills, and prenatal bonding it provides benefits all expectant families. As I work with families, unlike childbirth hypnosis programs that focus primarily on creating a pain-free birth or for mothers wanting a natural birth, my birth hypnosis course is taught in a private setting for the pregnant person, their partner or spouse, and support people if desired. It is designed for all parents looking to create a more relaxed pregnancy and gentler birth experience. For families that have or are enduring acute stress, fertility struggles, miscarriage, perinatal loss, a high-risk pregnancy, or a previous traumatic birth experience, the feelings of stress, past painful learning, and/or perceived threat are even more profound. Under these circumstances, it can become more difficult to release stress and return to balance. Regularly eliciting the relaxation response within the mind and the body becomes especially valuable to help counteract the effects of stress. And this has become the focus of my practice. I can personally attest to the power of birth hypnosis. It helped me to realize the birth of my dreams 13 years ago. My elder daughter gave birth at home to both of my grandsons. Her first birth was pain-free. Her second was very comfortable. It was just a little faster, and so a bit more intense. But honestly, she hardly looked like she was having contractions. And she had absolutely amazing water births. I believe that the relaxation techniques that I teach and those in hypnobirthing and hypnobabies, or the LeClaire method, or the calm birth hypnosis method, that they provide a birthing woman a focus and control not realized by the average birthing person. I have witnessed it hundreds of times, and the classes and relaxation techniques help mothers positively anticipate the birth of their babies. Most importantly, I have found the birth hypnosis techniques I teach and have taught, women report a feeling of empowerment, that they have learned skills they can use for the rest of their lives. If you would like to learn more about birth hypnosis, please feel free to reach out to me. You can find my contact information in the show notes or go to birthieshypnobirth.com. And Evidence-Based Birth, which I am a pro member of, did a great podcast episode about hypnosis for childbirth, and I encourage you to check it out. It will be in the show notes as well. So thank you so much for listening to this episode on birth hypnosis. I just love birth hypnosis so much, and I have seen some incredible births, and I have seen it provide transformation for parents. It truly is remarkable. So thank you again for listening and for being a part of my Birthies family. Thank you so much.
For more great conversations like these, or to find out more information and access Michelle's library of amazing guests, go to birthiesservices.com/podcasts. For more information on the Birthies method, Michelle's classes, meditations, and other services, go to birthiesservices.com.